Hey everyone, welcome back for some more developmental psychology. Today we're going to talk about Chapter 3, which is on prenatal development and birth. We've got our learning outcomes to start, but the big thing we're going to talk about for this chapter, is how we get from the sperm and the egg and this process of conception to this beautiful, fully formed neonate. So this brand new newborn that's coming into the world. I could look at pictures like this all day. I don't know if anyone else loves birth photography, but it's one of my all-time favorite things. I love it. If I had a better eye behind the camera, then might be what I would be doing with my life is, taking pictures of these beautiful babies the minute they're born. So I love it. I can look at it all day. I know not everyone feels the same. So here is a little bit of imagery as well, but this is what we're going to talk about. So kind of the fetal life up until the minute of birth. So we have to start with our stages of prenatal development. And so we have 3 stages. The first is the germinal period. So the first 2 weeks after conception, Mom does not know that she's pregnant, or that the person who's pregnant does not know that they're pregnant at this point. It includes the creation of the zygote, so it is actually attaching the zygote to the uterine wall and has this center line of cells it's called the germ disc, that will develop into the neonate, into the baby. But at this period, this early germinal period, just the first 2 weeks, but there's so much cell division going on at this period. The embryonic period, though, is weeks 2 to 8 after conception. This is a really, really important stage. So we're having a lot of our body structures, organs, neural tube develop at this point in time. So a lot of that basis for who we'll be in terms of our actual body structure is developed within this embryonic period. A lot of times the person who is pregnant will also not be aware of the pregnancy at this point. So 2 to 8 weeks, sometimes people will find out and they'll know they're pregnant, but for a lot of people, they don't find out they're pregnant until this fetal period. So 2 months or so after conception. It's not uncommon to not find out for a little while. I had a cousin who didn't know she's pregnant at all, just had her baby. So she thought she had appendicitis. It was interesting. We could talk about that. Well, not my cousin, but just, that happens. That happens sometimes. But 2 months through conception, 2 months after conception through birth, we call this a fetus. So most of the time, we'll just call this developing baby, we'll call them a fetus, because generally, for the longest stretch of time, that's what they are. But, we can technically call them germinal period, or the zygote, and, or the embryo and the fetus. But generally, we'll just use fetus because it is a fetus for a long time. Week 9, we'll see this differentiation of the ovaries and testes. So if you take a really early screenshot of a baby, but really early ultrasound, and you get to see the baby, you will not be able to tell if the baby, what their external genitalia will look like at this time. It takes a while for that flood of testosterone to come through to help shape that external genitalia. Weeks 22 plus, the senses are active. So the baby can hear you, the fetus can hear you. So sometimes people will sing to the fetus, they'll poke the fetus and, try to get them to feel, have certain flavors. They'll, introduce orange juice, things like that, because baby will react. So the senses are active, and there's been research on this as well. Some really fascinating stuff with reading certain poetry to the fetus, and it remembers and seems to like things. This is what we're looking at, though, with an embryo. So this is within that embryonic stage. You can see some of the major body structures at this point. So we can see, this really looks vaguely, human. But this amniotic sac is what I wanted you to see. So it's surrounds a sac, very thin sac, but very, tough or relatively tough. It's if you have your water break, that's what's breaking, is the amniotic sac filled with amniotic fluid. So this will surround and cushion the developing embryo. The umbilical cord connects mother and baby and connects the embryo to the placenta, and that's where it gets its nutrients from. And this placenta is this large organ here that grows and supports the developing embryo. And the placenta will be delivered after birth, so you don't retain the placenta. It's actually really bad to retain the placenta. It needs to come out. There are some interesting links down here in the slides if you want to read some of these things or look through. The 3D embryo atlas, I could spend way too much time on that. It pretty much just shows you actual bits of the embryo, not in a gross way or anything, or a cadaver type way. It's more of a drawings, but it'll let you isolate the nervous system and just different, the cardiovascular system, things like that. But it's drawings. Not that cadavers are gross, but, some people aren't big into cadavers. I'm one of them. I thought maybe I wanted to be a doctor, and then I realized, blood and, cadavers couldn't do it. We dissected a cat, And I was like, I can't do this. So, not that they're gross. They're beautiful, but some of us don't have the stomach for it. General risk factors, though. So we're talking about pregnancy, things we want to make sure of. Nutrition. So you want good quantity, so plenty of food to eat, good quality as well. And if we don't have enough folic acid, for one, so it's just one example of things that we need to worry about as a pregnant individual, but that can increase the risk for spina bifida. This is occurring super early, though. That neural tube is forming, and so many times they'll say if you are sexually active and of pregnancy age, or things like that, then maybe taking a folic acid supplement, or definitely if you're trying to conceive, you could speak to your doctor about taking folic acid. They also put it in things like cereal and stuff to help us generally have a higher level of folic acid. It's really important for that spinal cord. Stress, we want to avoid prolonged extreme stress. This isn't like going to work or anything, or, it's generally, as long as your work's not super stressful. But this is more of the prolonged and extreme stress, like trauma, living in a difficult, like, abusive relationship. One study they looked at was women who were right within the radius of New York City when the towers fell on 9/11, and how that led to higher rates of low birth weight babies. So the babies were born a little too early, or they weren't born, with enough birth weight. They were low birth weight. So that really extreme stress can impact the developing fetus. And mother's age. So generally between 20 and 35 is best. And this is for a lot of reasons. So before 20, it's often due to, maybe those first couple years, 18, 19, it's often due to more societal issues, as well as just having enough time for one's own body to develop. So people who are pregnant at 15, 14, one's own body is not fully mature and developed. You haven't gone through some of these necessary changes to more of an adult physical structure. And so that can be dangerous there. Above the age of 35, it's often harder to get pregnant and harder to sustain a pregnancy. Teratogens. So these are things that we definitely want to avoid. So we want to avoid, stress, extreme stress. We want to make sure we're getting good nutrition. We want to avoid teratogens. A teratogen is an agent that causes abnormal development. These can be all different kinds of agents. So it can be things like drugs, diseases, or environmental hazards. So, I think that's probably something we all know pretty well. If you are someone who is pregnant, you do not want to engage in high levels of alcohol use. It can lead to things like fetal alcohol syndrome, where the fetus is born with the cognitive and facial structures associated with FAS. We want to avoid things as much as we can, like certain diseases. Sometimes we can't avoid those things. People who have genital herpes will get pregnant, and that's okay. But they can help them to avoid maybe a vaginal birth at the time, so that it's especially during an active outbreak, so it's less likely to transfer to the fetus. Environmental hazards, things like lead and mercury, and then incompatible blood types. So some of these things you just can't avoid. Can't just have like, I just want to have a compatible blood type, and so instead they'll do risk management to mitigate it. So somebody with AIDS or somebody with an incompatible blood type, they will, do their best to avoid mixing any blood, and be very careful with the procedures that they do. The effect of the teratogen, though, a lot of times people want to know, like, what happens if you smoke crack and you're pregnant? It's really hard to say this is what happens exactly. And the reason why is because it depends on one's genotype, so that, expression of the genes, the timing in which you introduce that substance, and the dosage. So did you smoke crack once when you were in the embryonic stage while the heart was developing? This is going to have a different effect than if you smoke crack daily during the fetal stage all the way up till birth. It's the dosage, it's the timing, and you don't always see the damage at birth. So you have that show, I Didn't Know I Was Pregnant, which happened to my cousin. She didn't know she was pregnant. She had the baby and, looks just fine. Great baby, wonderful. Good baby, good job. And he is a great baby, and I love him very much. But she didn't have any prenatal care, and she wasn't engaging in the healthiest behaviors. And he did end up experiencing some learning disabilities. We don't know for sure that that's linked to the behaviors, but, my sister was adopted, and she, her mom used cocaine while she was in the womb, and she ended up having a stomach bleed when she was about 10 months old, and that was linked back to the cocaine usage. And so, you don't always see it right at birth, is what I'm saying. Not that I want anybody shamed at all. That's not the purpose here. It's just to say, you can't always say like, oh, someone used drugs and the baby was perfectly healthy the minute you see it. Sometimes those effects, we see them down the line. This picture will actually show you like the teratogenic effects. So it shows, this greatest sensitivity to teratogens during certain periods of development. So we've got the zygote, implantation, embryo. So this first couple weeks, this is the embryonic period, and then the fetal period. And this has a much bigger time scale there. So like week 9, 10, 11, 16, 20 through 36, and then full term. And so what it'll show is, especially in this early embryonic stage, we've got a lot of that red. So this is when the greatest sensitivity to teratogens is occurring. So if someone does engage in smoking crack cocaine, they're, 5 weeks after conception, that's when we see the eyes and the limbs in, particular, this greatest sensitivity, as well as some of these other features. And so that's how we have to know. We have to know the degree of sensitivity, the timing, the dosage. Pregnancy loss. So I would be remiss to just keep going forward like, oh, you conceived a baby and here's your baby. That doesn't always happen, unfortunately. And, miscarriage is a spontaneous loss before 20 weeks. And so this happens in 10 to 20% of recognized pregnancies, according to our text. Although some sources say it can happen even more with pregnancy. Sometimes you don't even know that you're pregnant. Some of these early, pregnancy tests will tell you that you're pregnant much earlier than we used to know. So things like the first response, early response test, they will tell you, practically the second you get pregnant, like, whoa, you're pregnant. And so then sometimes we'll have a loss. And so, it's hard. It can be hard. And often, though, due to chromosomal abnormality, especially these early losses, it's just, wasn't a viable embryo. There's something wrong where the chromosomes did not combine in an appropriate way. And so that's not it's valuable. I've had a pregnancy loss, so trust me, I know that was valuable to me, but it wasn't viable. So that's very important. I had a pregnancy loss before. It was my very first pregnancy. So that'll give you anxiety over the rest of them, right? But it, was very valuable to me, but it was probably chromosomal abnormality was what happened there. Stillbirth lost after 20 weeks, and this happens in 1 in 160 pregnancies. And this can happen for many different reasons, unfortunately. It is uncommon, but it is, is a very difficult loss to experience. But on average, what we're going to do is we're going to conceive, and we're going to get there to actually having to get this baby out. So we're going to deliver the baby. There's a lot of choices you have to make. So you're going to make a lot of choices. This is just some general ones, but where to have the baby, who do you want to help you in terms of medical care, what's going on there? Do you want to use medication or not? When do you want to clamp the umbilical cord? Sometimes these decisions you want to make and you want to tell them, I want this at a specific time. Other times, people want to go with the flow or whatever, and they'll just say, yeah, just whatever standard procedure is. Circumcision, if you ever want to get into a complex debate with people on the internet, you can just enjoy the circumcision debate, very complex one, but it's a decision you have to make if you have a male assigned at birth there. And then feeding preferences, you're going to breastfeed, bottle feed. This link is to the birth crawl, which is a choice that people might make where they just pretty much put the newly born infant on the chest and just let the infant kind of mush their way up to the breast and engage in breastfeeding. A lot of people, I know when I had my first child that, not my pregnancy loss, but my actual child who was born, I breastfed that child and they kind of took her head and then just like shoved it right on the chest. And that's not ideal. That's not what they're supposed to do. Generally it's a more gentle procedure. And so, if you have somebody, then if that's your feeding preference, you might want people in there who know what they're doing with that. And so there's so many more choices. You've got to make a lot of choices surrounding pregnancy and birth, and it's pretty much stays throughout parenting, right? And there's lots of choices. Stages of labor. So Baby Center is a great one. I put this link in here for you to watch some live births if you want to. I love watching live birth. I could do it all day. I think it's gorgeous. But I know not everyone agrees. But I think Baby Center, if you just want to Google Baby Center birth or go to this one, it's nice because this one is a site designed for people who are going to engage in the birthing process. So it's not fear mongering or, it's not like, oh, extreme birth. And you're like, scariest thing I've ever seen. It's pretty normal. It's trying to just help people realize like, this is what happens. Calming videos. I really enjoy them. But the stages of labor, the first stage, this one can take place, 12 to 24 hours after the birth, or before the birth, not after. Geez, hopefully you're enjoying yourself 12 to 24 hours after. But stage 1, we've got the cervix dilating, so we've got to get up to 10 centimeters, which is a pretty good size there. Stage 2, it's about, a little less than an hour before birth, baby's head appears. So you'll actually start to see the fetal head emerge. You can see if you were sitting here, you'd be able to see that bulge of the fetal head, which is amazing. And then, so the head should come first. The head's the largest part, head and shoulders. And so we need to deliver that first. You do not want the feet first. Some practitioners are able to, make things like that work, but on average, we want the head come first. And then stage 3, minutes after birth, you have to expel the placenta. So that's that organ that helps sustain the baby. It needs to come out. And many times they will palpitate the uterus from the external palpitation and make sure that the placenta has been delivered. You want that out. Birth complications. So, it doesn't always go to plan there. You might need a cesarean section. So with that one, you can see one here kind of drawn in a picture form, but they'll need to deliver the baby externally through a incision. That can be because of different things like breech, so they're not in the right position. I had my most recent son, I have 3 children, but my most recent son was pretty much sideways, which was odd. He just kicked me like all the time in the liver or something. It was weird setup. But he wouldn't come out normal. He wouldn't come out. So they had to go in and get him. And then births before the 37th week is premature, less than 5.5 pounds, low birth weight. You can be both of those things, or you can just be one of those things. So sometimes you're birthed at 40 weeks, but you're low birth weight. Sometimes you're premature, but you're actually, born really close this near term, and you're larger, you're 6 pounds or so you're not low birth weight. But those are our terms. And then if you're small for date, that's a weight below normal for length of pregnancy. So you expect a certain range with a length of pregnancy, and you could be small for date or large for date. My most recent son was large for date, and they had to, check his levels and everything, make sure he didn't get jaundice. So he had a lot of things going on there. But it was fun. The postpartum period. So, I said hopefully after, 12 to 24 hours after birth, you're having fun. Well, it's not always all fun. There's a whole bunch of physical changes, not to mention emotional and psychological changes, but it takes a while for your body to kind of feel normal again, and definitely for your emotions. And it's a huge adjustment, especially going from no children to having a child. It's a big difference. And so this TED Talk, I really enjoy. It talks about an idea of matrescence. So like adolescence as being a period that we go through where we change and grow and develop. Matrescence being one of those as well, where people develop into a mother. And then, you're dealing with a lot though. Hormones, fatigue, sleeplessness. It's a whole big old chunk of stuff that you got to deal with. Your body may not feel like your own. A lot of people are surprised. They bring their pre-pregnancy clothes to the hospital and they expect to fit back into their like size 6 jeans or something. Your uterus is still quite enlarged at this time. Some people may have had a cesarean section. With my first daughter, they had to try to use other tools like forceps to remove her. And so it's very swollen. None of my kids came out the way that they're designed to do. They, all of them were cesarean. They would not leave my body. They just wouldn't do it. And so, you never know. You never know what's going to happen. But it is an adjustment then. I think most people would say it's an adjustment. I don't know very many people who've given birth and been like, you know what, that was nothing, and then just gone back with their lives. It's an adjustment period. And so it's a physical adjustment, it's a psychological adjustment. Many people will experience postpartum blues. So 2 to 3 days after delivery, within, normally subsiding pretty early as soon as you kind of, realize, okay, this is who I am, this is what I've got to do. And you kind of get back into your life and you feel okay. About 20% really will have no symptoms, so they feel great. I'm jealous of these people. I've never had that. I've had hard births. My kids would not come out. Yeah, that's a whole long story. I'm sure nobody wants to listen to forever, but, I've never been in this category. I know some people are, they feel great. And then 10% though, really, they have postpartum depression, and even a smaller percentage of that is the postpartum psychosis. Both of these really benefit from some help. So a counselor, a psychiatrist, psychologist, whomever, to help one deal with, these feelings and these baby blues that have, or this, kind of baby blues that have developed into something more, to a depression or to psychosis. Depending on what's going on, someone may need medication or therapy to help them cope. But that is the end of our chapter. And when we get back in, we will talk about infancy. So all of the big stages of infancy. And that's a big fun chapter. I love it. Or chunk of chapters, actually, the way we discuss it. But I will talk to you then. Thank you.